We will then start our timer to initiate this drill. The first maneuver is to grasp the right-hand side of the foam and to orient the needle such that the needle is on the top part of the foam. We reach across this, close the device, flip the switch externally, which will toggle our needle to the other jaw. If the tail is in the way, this can be flipped over onto the side. We then use the Maryland grasper to grasp the second piece of foam, and as you can see, my needle is not oriented correctly. I have two choices. I can either switch the needle to the other jaw by closing the device and toggling, or if my needle was positioned initially like this, I can simply turn the device to come in from the underside, take a second full thickness bite, approximately 5 millimeters from the edge, somewhere approximately across from the first bite. And then I have two choices. I can either orient the device in the forefield and grab my tail in the backfield as shown here, or if I would prefer, I could hold the device in the backfield and grab the tail in the forefield. My preference is the first choice as shown here because it makes the tying of the knot a little bit simpler. So we pull out most of the redundant suture strand, hold up a relatively short tail to approximately the 12 o'clock or straight up position, and then we have to turn this device about 180 degrees such that our suture strands are now crossed, and the empty jaw of the device can then go underneath both suture strands. The needle can be switched to the other jaw, and then we have a nice square knot that can be pulled flat, and once we have pulled this flat, the timer can then be stopped and the drill is completed. So here's an example in real time. The first foam appendage is grasped, the needle is switched, the second bite is grasped, the tail is held securely in the back, the sutures pass through, the knot is tied, and the stopwatch is stopped. The proficiency level for this task is 17 seconds. As you can see, we do not tie second or third or fourth knots as part of this task so that we can simply pull out the suture and reuse it for consecutive repetitions without needing to reload the needle. I will now demonstrate the alternative configuration. If we take the first bite as shown here, the second bite as shown here, and then grasp the suture in the forefield, we then have to place the needle, turn it, and place the needle underneath those two suture loops as shown here to create our knot. Either format is acceptable, but I prefer to pass the empty suture jaw within that suture loop to create the knot because I find it is easier. Some of the errors to avoid will be now demonstrated. Certainly if we grab too small of a bite of foam, a very partial thickness bite, this can pull through as we cinch down on the knot, so that is to be discouraged. As we had previously showed, about a 5 millimeter bite back from the edge seems appropriate. There are no targets for placement of the suture. The suture can be placed anywhere along these edges of the foam. However, I find it very helpful to place it somewhere within the center of the field of view. As you can see, if the suture strand gets a bit tangled, it can simply be pushed out of the way, and then the second bite can be taken. If a bite that is too large is taken, as shown here, it will then make the tying of the knot a little bit more difficult because such a big bulky piece of foam is required to lay it down secure. So again, I would recommend a 5 millimeter bite of foam. The other aspect that should be pointed out, if you look closely at the jaws of this clamp, only the distal third coap tightly enough to grab suture. So if you try to grab the suture strand with this particular Maryland grasper anywhere deep within the jaws, it does not close tightly enough and the suture can simply be pulled through. So an element of precision by using this particular grasper is that the suture strand must be grasped relatively close to the distal third of the Maryland grasper. A protocol violation is what we call one biting. and that is when people get clever and they try to get very short times, they oftentimes will take one bite across the two strands. We do not want to encourage that, and thus it is considered a protocol violation. As shown previously, these should be grasped individually and separate bites should be taken as shown here, and then the knot should be tied. Another pitfall to avoid is taking bites that are too far away. As shown here, if your first bite is about that location and your second bite is very far away, then certainly it will be difficult to tie the knot and to lay it down appropriately, and the two pieces of foam simply do not approximate their edges, and that is a protocol violation since the two don't come together appropriately.